So we're going to move to the independent sector now, for obvious reason, because this is the system, right? So our next speaker is Andrew Cowderoy, and he was formerly Director of Operations at Nuffield Health and an RAF veteran. Andrew is currently completing a doctorate focused on transitional depression in the Army, combined lived experience with academic research. Andrew, over to you.
Thank you, Guy, and thank you for the invitation today to come and speak. I was warned not to overrun with PhD, but it is exciting and it does contribute and it does resonate with so many of you that have spoken before me. So it's quite a good forum. So thank you. My name is Andrew Cowderoy. I was former Director of Operations at Nuffield Health, recently moved to another organisation, which hopefully start that journey again. First slide, please. So at Nuffield Health, a registered charity, my appointment as Director of Operations, exciting. I've worked in independent sector as a physiotherapist and then grew up into operations as I matured into healthcare. But all the way along, I couldn't let go of my background and also how my role as a physiotherapist on the wards in musculoskeletal clinics, how I perceived that veterans, former RAF, former Royal Navy, former Army, seemed to get on better with me in terms of outcomes. And it was that took me down the academic path. But certainly at Nuffield Health, the opportunity as a Director of Operations was to take the Armed Forces Covenant forward. And that's what I wanted to discuss first. So next slide, please. So Nuffield Health, part of the private independent sector, we provide health and well-being for every part of you. That's why we're connecting your health and well-being, spanning physical and mental health, from personal training, health assessments, GP services and physiotherapy, to providing mental health support or hospital care and treatment. So that's the strap line. But where do I fit in with that? So I think part of Nuffield, part of my hospital, which was Nuffield Health Parkside in Wimbledon, SW19, a very nice area, very affluent area, was about, well, how do I engage with the military community here? How do I get involved with my senior leadership team, the hospital exec and all the staff at the hospital to say that, hey, hang on, I'm a veteran. How can we magnify that message? How can we really go out to the community and help those that are supporting our hospital, whether that's through charitable work or whether that's through a patient or a family member of. So Nuffield has 38 hospitals across the country. We also have, and we're quite lucky to have, 112 gyms across the country. So most of our units, our hospital units, have an affiliated gym. I was fortunate at Parkside in Wimbledon to have 12 local gyms that I could access, and obviously our beneficiaries accessed. So straight away, I could go out and gauge what that veteran community looked like by putting a poster up, and that's where the journey started. Next slide, please. So Nuffield Health signed the Armed Forces Covenant in 2016. We got Defence Employer Recognition Bronze Award in 2016 too. We have many more pilots now, but NHS Veteran Aware Accreditation at Plymouth in 2023. Quite lucky, we got Veteran Aware Accreditation at Parkside, at Nuffield Health Parkside this year, on the back of some great work with Tony Armstrong, who I know I've seen on this call. So thank you, Tony, for helping us through that process. We have several SLAs and contracts for care of local armed forces community because we have that outreach. And as I mentioned, 2025, through the ambitious plans of our of the executive team, Alison McCourt, who I'll come on to in a minute, really wanted to push for that silver award and then ultimately gold award next year. So quite ambitious. I wanted to get involved. I was hungry to get involved. I was 5 years into my PhD and thought I had a lot to contribute. And that's where we kind of met and had that relationship. Next slide, please. So Alison had a distinguished journey. I've got a list of all her commendations and her career, a phenomenal career in the Army. I think most importantly, appointed Chief Nursing Officer in 2018 and awarded CBE for her leadership and military training, military nursing. But the recognition that stands out, and I suppose resonates with some of the earlier talks, is awarded the Outstanding Contribution Award in the 2021 Women in Defence Awards. So phenomenal person, a phenomenal individual. I haven't asked her personally which cap badge she prefers and on which side of the employment sector she prefers, but I know deep down that her loyalty lies to that badge, and rightly so. Alison was promoted within work, which is phenomenal, and hence my call to arms to take over that mantle, to take Nuffield Health to silver. Next slide, please. Okay, so as mentioned, an RAF veteran, joined in 1990, weapons technician for the best part of 10 years, at which point I felt mature enough to apply for aircrew, which I did, but unfortunately my health got the better of me, or the worse of me. So I'm now type 1 diabetic, so permanently unfit to fly, but I still want to contribute, and I still feel I have a place to contribute to the armed forces and those that support, whether that's families of, brothers of, fathers of, mothers of, sisters of. It's been a great experience coming into physiotherapy and meeting those individuals. The Parkside journey, we set up Sierra Whiskey 19, which is the breakfast club. I set that up. I put a poster in the 12 gyms and in our hospital, and also in the local church, because our minister comes every the last Friday of the month to meet anybody, but he always seemed to be there when I was in the canteen getting a coffee. So we discussed my plans and Alison's plans, and he advertised that in the church as well. So the breakfast club was a jump into the unknown. It was all funded by me. I didn't know if I was going to get one person or 20 people. And I think what you've learned from this presentation so far, and all the other presenters before me, is it doesn't matter. It doesn't matter who you reach out to or who connects. It's about getting that message out there. So the breakfast club was set up with the underlying theme that diversity and one team were pulling together across 12 gyms and one big hospital, and hopefully some other parish. So the breakfast club, I think what's unique about the breakfast club is I am the only British veteran that attends. So there are some that choose not to and who have served. There's some fantastic orthopedic consultants who commend the work that we set out to do, but they just don't want to get involved, which is absolutely fine. The team was made up of mums, brothers, sisters from families in Italy, families in Spain, families in Malaysia, families in India. So it was quite diverse and phenomenal, and they all had a story to tell, and that's what the breakfast club was. It was just a story, and we brought a theme and we talked about it, and that worked really well, and it grew from that. So from that small, I want to say seed, but probably more appropriate, more small croissant and a coffee, the group just grew and grew. And that's where we got the Silver Award and the Veteran Aware accreditation, because we did some work. We recognised what we needed to do as a hospital organisation, as a private provider, and that's where we got more of our central functions involved in terms of policy and trying to capture data on who comes in, whether that's a patient or whether that's a staff member, whether they've served or have a connection to the veteran community. But all that data processing takes time. It's all voluntary. Alison is well aware of what we need to do to get to gold, and there are steps, because the exec appreciate the impact that would have on the service and what that impact would have on the community in and around our hospitals. So obviously this year we had a VE Day, so we wanted to do a piece of work for VE Day. Next slide, please. So our breakfast club got together. They provided photographs of all their family members who had served through times, and it was a great response, a really good response, which we celebrated with the whole hospital, the hospital director and the staff, with a breakfast, extended breakfast, which was well received. Next slide, please. which brings me on to my PhD. So again, I don't want to take too much time up because guys warn me, but my transitional depression in the British Army title came from my master's, which was looking at how and why I got a better response out of patients. So for example, if I was treating somebody that had a former CAP badge or a family member of, and I was treating them to improve their function, we just got on. We had that shared experience, that lived experience, or as the colleague before, living experience of service life. And yes, there was lots of banter and with the RAF and the Army and the Navy, so which helps, and that helps that relationship and it builds that relationship. So following the master's, the PhD really was a two-part study looking at well, when you set off on a PhD journey, you want to solve the world. And I thought I'd solved so many problems, certainly some of the ones that have been mentioned today, through that transitional experience. And I interviewed 11 phenomenal people on part two, former Army veterans from right up to commission through all ranks. And some of them might be on today. I'm sure they will be. And it was phenomenal just to listen to their stories and to try and understand their journey through that transitional process. And ultimately, there is many things that impact that transitional process, which again pulls into the Breakfast Club, it pulls into day-to-day working in a clinical background, but looking at identity, culture, but also that temporal component, that time component, because although we transition on a Friday and start work on a Monday, that transitional process for some can take a lifetime, and that's what's coming out of this data. So it's almost in. It's got a few iterations post feedback, but big thank you to Dr. Jackie Day and Dr. Pam Richards who've supported me through that process. But certainly the ultimate goal is to give something back. And if I can help the armed forces community in any way through that academic research and maybe even go on beyond, I don't know, I might need a bit of a break after a PhD, but certainly it's been very rewarding. Next slide. I think that's it. Yep, that's it. That's me. Thank you very much. And thanks for your time. I'll take questions later. Thank you.
Andrew, thank you very much, and thank you for keeping it to time as well. I know you could have talked for a lot longer, but yeah, an incredible journey. You personally, actually, and also Nuffield, who are doing some brilliant stuff. I think you referenced Tony Armstrong. I'd reiterate that. He is our lead for the independent sector, and he's doing a brilliant job. So thanks very much, Andrew, for your contribution, and certainly for setting that bar higher, actually.